And we're going to get started, and I'll walk us through our agenda today. Welcome everyone to the Taste of Success series, and we are here today to talk about healthcare administration and management, and different career paths, different ways to break into the field. And we have two alumni with us today. We have Ron Luskin, and we have Marissa Sandkuhler. So welcome, Ron and Marissa. It's great to have you with us. I'm really excited to ask you some questions and to have you share your experience with our audience today. So welcome, students. We're glad you could join us. My name's Maureen Muldoon. I am a career and internship specialist for SuccessWorks, and I advise students in health, environment, and research related careers. So I'm interested in this topic, and looking forward to diving in. So Marissa and Ron, I'm going to give you an opportunity to introduce yourselves and share your undergraduate education, and a little about what you're doing now. And I will hop into a few questions to get us warmed up. And for all of our students here today, you're going to find in the chat shortly more information about our panelists to help you think about any questions you might have. And we can take questions in the chat, and we can also have you unmic and unmute, and also turn on your camera if you wish. It's entirely up to you. So you'll see in the chat the form where we have Marissa and Ron's profiles. So with that, we will get started. So Marissa, if you would like to start us off, that would be great.
Yeah, perfect. Thanks, Maureen. So I'm Marissa Sandkuhler. I graduated from UW last May. So it's been an interesting experience for me, kind of transitioning from undergrad to grad school, all in this virtual environment. So that's been an interesting experience. Currently, I'm getting my Master's of Healthcare Administration at the University of Minnesota. So that's been really great for me to really dive into healthcare administration, because in undergrad, I majored in psychology and then had certificates in global health and business. So that kind of exposed me to the field. And now I am looking towards kind of different fields of healthcare within patient experience, quality improvement, and healthcare operations. So I don't have as much experience yet, but I can easily talk on what decisions I made and what learnings I had to get to where I am now in grad school.
Great. Thank you, Marissa. And Ron, if you would like to go ahead and introduce yourself and share a little bit about yourself.
Well, I'm going to take just a couple more minutes than Marissa, because I've been out of school just a little bit longer. So I graduated from UW in 1975 with a degree in history. And I wasn't quite sure at the point in time that I was about ready to complete my undergraduate degree, what was I going to do, just like you're thinking right now. But the catapult for me was I worked at the Daily Cardinal, and I sold advertising. And my first job was in newspaper advertising, and I had a career in newspaper advertising for several years and rose to a level of management at the Milwaukee Journal-Sentinel. And one of the things that I undertook in those days was HMOs, health maintenance organizations, were new in the 80s. And I became I developed some specialized expertise and helped lead that category in working with insurance companies that were engaged in development of health maintenance organizations, another form of insurance, which leads me to another facet of opportunities for careers in healthcare being working with insurance companies that are engaged in healthcare insurance in one form or another. Another phase of my career, I spent several years leveraging what I developed in marketing, advertising, and public relations. I became a business development director for architecture firms and engineering firms that built facilities like hospitals, group practice clinics, and if you're familiar with some of the healthcare provided here in Madison, so like St. Mary's Hospital or the Dean Clinics. And here's a guy who had a history degree but found his way being able to work with healthcare administrators to find out about their problems and what solutions did they need that would be accomplished through facilities. Oftentimes those types of things may be improving the patient experience, the staff experience, improving medical outcomes, and I became a specialized expert in being able to convey that information so that my company would have the wherewithal to design those healthcare facilities. So another factor in terms of what types of careers are available and out there in healthcare administration is the vast majority of healthcare administrators are not necessarily doctors or persons who train to be a nurse. The vast majority of healthcare administrators are people who may have come through a liberal arts degree or complemented with knowledge in finance, who run and administer hospitals, who run group practice clinics, and who also are involved in administering specialty clinics as well. So I'm going to stop right there because I don't want to talk too long, but I wanted to give you a little depth and breadth of some of the kinds of things that I touched upon in my career, coming from a guy who studied American history.
Great. Thank you both for those introductions. What I like that we have here today is Marissa, who's on the front end, and then Ron, who is actively retired. Looking at your LinkedIn profile, Ron. So in thinking about where you both are, I'll ask you both another question, and then we'll see what our students have to say. Marissa, thinking back to your recent past and the different experiences you had and the majors you chose, and knowing you had an interest in healthcare, how do you think you first became aware that you could go on and do a master's in an area of healthcare that wasn't necessarily one-on-one working with a patient?
Yeah, so I met with Maureen a few times during my undergraduate experience, so she knows a little bit of my background. But I had started off pre-pharmacy and then had moved into pre-nursing. So I was very much interested in healthcare, and I didn't exactly know that there was an administrative side of things. I actually was doing some volunteering through the pre-nursing club, and there was a panel there meant for high school students talking about different careers in healthcare. And there was what's called a fellow at UW Health, and he was an administrative fellow, and he was talking about his experiences and what he was able to do within the healthcare sector. And he was talking about like bringing on positive change, innovating, making new solutions to problems that are seen in healthcare every day. So that was something that really interested me, and I went home that night and did a ton of research, looked at all the different career options, and that's when I started to get excited about things. And I was actually in a sociology course at the time too, Social 170, and they talked about like health disparities and social determinants of health, and that's kind of what really clicked for me. I was thinking like, oh, I can get into this field and I can help these people have more access to healthcare, and I can make a difference in their lives, not by directly caring for them, but by working on policies and developing procedures and being able to influence that side of things. So that those experiences combined really made me realize that I did have the ability to drive positive change, whether I was a nurse or whether it was in the background of things. But I think it works a lot better with my skill sets too. I struggled through anatomy and physiology, so that was something that was another indicator to me that maybe it would be good to look at something, and I ended up really enjoying my business classes. So that was another telltale thing that helped me to realize that I was on the right track then.
Marissa, I'm going to ask you a question. Maybe you can talk a little bit about the social determinants of health, because I think it's possible that students may not have a good appreciation for that. And if there may be some people who are on our call today who are into statistics, what it is that may mean in how somebody who's got good IT skills, statistics skills, could apply those things in that area that you just referenced.
Right, that's a really good point. I didn't even think of that. Thank you. So social determinants of health are different factors in a person's life that make an impact on the health care that they receive. So for example, there's a lot of health is determined by someone's zip code. So if you're living in a zip code where you may not have a hospital within walking or transit distance, if you're living somewhere where, or say career, there's some jobs where you may not be able to get off of work within hours that a clinic are open to see a primary care physician. The color of people's skin makes a difference on the impact of their health on the health care they receive. So there's a lot of different factors that people may be born into and don't have much control over that determine their health care. Rather than the actual care provided, it's the difference in being able to access that care and truly receive the highest quality care, if that helps for anyone who may have been wondering a little bit more about it.
And what we find is that there's statisticians who mine that kind of data for healthcare organizations so that they can better serve their patients.
Those are both great explanations. You know, Ron, I love that question. You know, as Marissa keeps talking, and we do have one that came in here about taking specific coursework to better prepare you for grad school. Are there courses that definitely helped in making that decision, or courses that you could recommend that you remember?
Yeah, I know there were a few, since I switched majors so many times, it was hard for me to get all my credits in 4 years, so I was kind of pinched for things by the end. But I know that within the Global Health Certificate, there were definitely some courses I wish I could have taken. I don't remember the names of them offhand, but they just seemed really focused on like social determinants of health and like the ethics of healthcare and things, which was, I know there was one on ethics in healthcare that I wish I would have taken. A few business classes also may sound intimidating for people who aren't business majors, but I know doing the business certificate really helped me, and a lot of my fellow students don't have any business experience at all, so it's totally okay if you don't take those in undergrad, but if you are looking to gain that experience, it's a great place to start off.
All right, that's a great answer. What type of experience, jobs, internships, volunteering would you recommend during undergrad to prepare for healthcare admin? Either one of you, feel free to jump in on this one.
I know in undergrad, I think one thing that I was missing that I wished I would have had was some sort of clinical perspective, whether it be as a CNA or like an administrative assistant in a hospital, just being able to see those, if hospital operations is something you're interested in, which is something that I'm very interested in, I think that'd be something that would be helpful, just to be in that environment and looking and seeing what's going on. And it always helps. I know, I believe Madison has gone to a few meetings, but Partners in Health Engage was an organization I was really involved in undergrad, and I really thought that prepared me to just learning about the access to healthcare and health equity, which was really cool. I did an internship in human resources, and I thought that was super helpful too, just to have like an organizational perspective and kind of see how businesses work, which was something helpful, but also not necessary at all. I know there's people in my program who come from all different backgrounds, so it's a very flexible field, and it's really cool to hear other people's personal perspectives too.
So I'm going to I'm going to suggest this. I may not be up to date on what kind of internships are the pathway right now, but what I would want to do is underscore this. I know that those of you who are here today have probably heard a lot about networking and mentors. And I think what you need to do is even though it's the COVID era, you need to push yourself hard to make connections with people in your network or establish a network and mentors. I'm gonna give you one example. I'm a member of the local Rotary Club, and there's a young man that I've been mentoring who's a first generation Latino student at Edgewood College, and he's shown an interest in aspects of finance, and he asked me if I could connect him with some people. And through the relationships that I had, I was able to connect him with a gentleman at Park Bank, and he's now employed at Park Bank. So he went past the internship to having an actual part-time job. Then, a few months went by, and he asked me some more questions about aspects related to the financial services area, and I was able to connect him with two other people who are um, financial advisors. So find one way or another, find a mentor, and have the opportunity to then get that network connected and leverage those things. And it's hard sometimes. It's really hard to ask people for help. But let me tell you this, when you do, people want to help you. They'll feel appreciative of helping you. And you know who the very, very best people are that you can ask for help? It's other Badgers. We're all waiting to help you, but we just need to be asked oftentimes.
Nice plug, Ron.